Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. Today I will explain some of the jobs that in the hospital. I'm Dira Vitasari with regular class 1 E1 NIM P1337420123054 study program T3 Nursing Semarang. Pharmacy. Pharmacy is a profession that has competence in dispensing drugs prescribed by doctors so that there are no wrong doses. While working, he is also responsible for drug stock matters and must update regarding drugs that are no longer allowed to be circulated. Pharmacists are also familiar with the biochemical composition of drugs and how they affect their use, side effects, interaction, and implications for their effectiveness. The profession of a pharmacist cannot be taken like child because medication error can be very dangerous for patients. Physiotherapy. Physiotherapy is a service provided to patients that aims to improve, maintain, and restore the patient's health. When someone has a health problem that interferes with motor function so that it affects their physical activity, physiotherapy can provide a solution. Physiotherapists, also known as physiotherapists, will assess, plan, and implement rehabilitation programs that can improve or restore human motor function, maximize movement abilities, relieve pain symptoms, and treat or prevent physical problems related to injuries, illnesses, or other disorders. Anesthesiologists. Anesthesiologists are specialist doctors who are responsible for providing anesthesia to patients who are about to undergo a surgical procedure of surgery. Besides that, the anesthetist's role is very important in monitoring pain management and patient-intensive care. The roles and responsibilities of the anesthesiologist are very important. Before carrying out surgical procedure or treatment related to pain, the patient will definitely consult an anesthesiologist and surgeon. Be sure to tell the condition and medical history you are experiencing. If you have an allergy to a drug, don't hesitate to inform this to the anesthesiologist. Optometry. Optometrist is the profession responsible for administering a series of eye tests, in charge of treating the eyes, prescribing glass or contact lens to diagnose a condition. The responsibility of an optometrist is to check visual acuity. Ophthalmologists can also prescribe a glass lens and contact lens to patients. Someone with visual impairments such as deafness, fartness, and astigmatism is susceptible to consult with a health expert. They can provide simple vision aids and vision-related therapies. Waiters. A waiter is someone who is responsible for providing food and beverage service to patients, doctor, nurse, and other medical staff at the hospital. While working, they are often in the kitchen cooking and plating good food. Waiters judge, prepare food and drink, serve food and drinks, ensure the availability of enough food and drink, maintain cleanliness and sanitation, serving food and beverage requests. Ambulance driver is an emergency. The patient cannot to go to the hospital personality or needs emergency medical assistance. Therefore, the hospital provides ambulance facilities to help patients in emergencies. The ambulance driver is on duty to drive to ambulance car. Driving an ambulance is not careless because you have to pay attention to the patient condition. So, the profession of an ambulance driver is not an easy task. Well, apart from being good at driving, they are also required to have additional knowledge and skill to support their work. Moreover, so that patient and the medical team feel safe and comfortable to get to their destination quickly. Hospital security guard is someone who has the duty to monitor overall hospital security, coordinate all technical activity related to security at the hospital, and maintain security and order at the entrance gate or exit gate in the hospital area. Thank you. Those are some of the jobs in the hospital. That's all from me, more or less the same story. Wassalamualaikum warahmatullahi wabarakatuh.